There are so many advances in oncology right now, and that's one reason I think this is so exciting.
The annual retreat is a retreat that we have every year with our sponsors from pharma.
It has grown tremendously over the past 5 years, and this year is probably our biggest event.
This is a phenomenal retreat. It's once a year and pretty much summarizes what happens the previous year in advanced therapeutics and in advanced care for our patients.
The role of the APP in oncology has evolved tremendously over the last many years. As our therapies are better, patients are living longer with cancer. Because of screening, more patients are being diagnosed with cancer. We want advanced practitioners in the network to treat their job here as their dream job and not just a job.
Our priorities both for RCCA and US Oncology is to continue the work we've done, both through adding new practices under the RCCA umbrella, and then also adding diversification, whether it's through imaging, radiation, or new classes of therapeutics.
The year ahead is going to be a very busy year. I will consult with the practice and help find and troubleshoot all of their pharmacy needs.
The Pharmacy Solutions team have dedicated experts on the team, so it's built out of pharmacists that have various backgrounds, leading health systems or community oncology practices, as well as analysts. And each practice has their own dedicated Pharmacy Solutions director to bring to them specific opportunities that would be appropriate for their practice.
What we've learned is that we can actually do a lot more for patients through the innovation, and that we've learned that the partnership with our pharma partners is very important. Dialogue between clinicians and pharma early on can actually spur innovation and actually helps us focus on what areas are important to physicians, what physicians think are areas for pharma to focus their attention on in terms of growth and innovation. And I think that ultimately, again, comes back to the patients.
The pharma is working with us, and we're very grateful for their sponsorship and their attendance, because they will be the ones who drive large clinical trials that will be adaptive and compatible with our patients in the communities.
We really support our advanced practitioners from all facets of their practice to make sure that they're set up to succeed and they have the ability to do that throughout their career.
Peer review is always, or peer discussions are always good, especially from a different practice.
The topics we covered today included prostate cancer and breast cancer, and both were very informative, and both actually had updates from this past year.
It's been a really interactive experience. We've been able to meet with all the other physicians, as well as pharmaceutical rep members, as well as physician scientists, and get better insight into how to best serve our patients.
It's a very exciting atmosphere. I think people are learning a lot, people are motivated, and it just feels like a very energetic vibe today.
Hearing about anything that's new and up and coming, I enjoy listening to, so we stay current in being able to treat the patients with 2023, 2024 medical care.